Hello, a very good evening to everyone here. Thank you so much for freeing your time to attend our live talk today. I am Liang Lin. I'm the Associate Dean of the school at IMU. And today we have Dr. Ranjeet Ajit Bapat to talk to you about advancing yourself with implant dentistry. So before we go on, I would like to announce a few of the housekeeping rule here. We have muted all your microphones. And if you have any questions for us after the short talk by Dr. Ranjit, please feel free to put your questions in the chat box. And we will try our level best to answer all the questions. And for your information, this live talk will be recorded and it will be posted up in IMU's YouTube channel. And the link will be forwarded to you and you can share it with your friends. Yeah, so that everyone will come to know about this program. And if you have further questions, you can always email to IMU. Okay, I give you Dr. Ranjeet Ajit Bapat. Dr. Ranjeet?
Yeah, good afternoon, all the doctors who have joined for this live talk series organized by the School of Dentistry, International Medical University. I welcome you one and all. Thank you for sparing some time of your busy schedule and attending this live talk. So this live talk is going to be basically information about advancing yourself with implant dentistry. Doctors who have started with their implant practice or who are keen on venturing implant dentistry as a part of their general dental practice. This talk will be of much help because I will be taking you through what exactly we are doing it in IMU over here. Yeah, we have a program by the name Postgraduate Diploma in Implant Dentistry. And we have been successfully running this program for the past 4 years now. And we really feel happy when we look back that, the graduates who have done this program are really doing well, and we hope that they flourish in their future life in terms of the implant dentistry. So just to give you a brief introduction, about myself, I'm Dr. Ranjeet Bapat, and I've done my master's in the field of periodontics and implant dentistry. I've done from Mumbai University, and I've also received the implant fellowship from the Indian Society of Oral Implantologists. Since I've done my master's, I'm also into academics and clinical practice. I have a lot of interest towards periodontology and implant dentistry. Yeah, and since then I've been practicing a lot of implant cases and perio cases, and currently I am the program director for the course Postgraduate Diploma in Implant Dentistry in IMU. Just to share about the program, we really feel nice that this program, when it was launched first in 2016, it was quite a challenge for us to see, how it's going to go, how it's going to shape up, and really it has shaped up really well. The evidence for this is that this program received the best new development award as a new program in IMU. And later on, as we went on with the developments and revisions and fine-tuning of the development of this program, the program also was the recipient for the IMU business process improvement for implant clinics. So these were, as we have moved ahead, we have seen a lot of a bit of success in achieving towards the success of this program. Yeah. In terms of the program, this program is basically designed specifically for the general practitioners, yeah, who can accommodate or who can include implant dentistry, or who are keen on using implant practice as a part of giving scope for their patient community. So the basic aim of designing this program is to provide or impart knowledge to the registered doctors in this program by face-to-face and online lectures. And we have also developed a lot of innovative teachings like the case-based learning and online teaching and assessment activities, which will help you to understand what exactly is the evidence-based part of implant dentistry. Other than development of our cognitive skills, which is very important, which forms the foundation of any science, you also need to go ahead and implement it, what you have learned. So for the implementation point of view and from the skills development point of view, we do provide them who have registered for the course with hands-on activities like the preclinical sessions, the mock sessions on mannequin, where they can actually experiment a lot of different techniques. And also once they are well equipped with their preclinical skills, we do slowly give them exposure on live patients in doing variety of implant cases. So just looking and having a glance at this PG diploma program of implant dentistry, the diploma program is designed for working dental practitioners with flexible learning. Now we have made this flexible in the sense is that most of the times, if you see that any course where we have, you need to be there for a quite number of hours. But in this program, you don't have to be there continuously in the university. It's a very flexible option of learning where you just need to be there for a few days as per the curriculum planning to IMU to imbibe knowledge, and then later on you can implement that knowledge in your clinical practice, either in IMU or in your clinic. So to go ahead, this program is divided into 8 courses, and it will run across 4 semesters with a total of 30 credits to be delivered over a period of 2 years. The reason to include these 2 years is because we want when you are graduated or when you graduate from this program, we want you to be well equipped with the understanding of the science of implant dentistry. That is very important. We don't want you to be just like those dentists with half knowledge with those weekend warrior courses. Yeah. So the aim is to train you well in totality, having a holistic approach towards right from your case selection till your delivery of the implant care to the patient. In other than this delivery of the 8 courses, in that we have innovative teaching and learning methods. As I said, we have certain online learning activities, like we have something called as iLecture, where you can go through those lectures and then you can take up the assessments other than your face-to-face activity. Yeah. So also we have something called as online case discussion sessions. So for example, during this COVID, when we have the graduates who couldn't come to the students who couldn't come to the IMU campus because of the COVID-19, we did conducted around 10 to 15 ECBS, that is the case discussions, where the students were given a lot of knowledge in terms of discussing variety of cases, which really helped them in planning and execution of their cases in their clinics. And the most important is, once we have gained the knowledge through these teaching activities on face-to-face and online, the most next important steps which everyone of us we look for is the implementation of the clinical activities. So for the clinical activities, what we have done is many a times the practitioners don't have sufficient time because of their busy practice schedule to visit IMU clinic. Yeah. So we do have given an option in this program where the students or the one who have enrolled have the option of coming to IMU and doing the patients, or we also have made arrangements, special arrangements where the clinicians or the practitioners can do the implant cases in their clinics. Yeah. So we have certain guidelines, certain supervision guidelines dedicated only for the practitioners who want to complete their clinical cases in the clinic under this course. Yeah. So just to take you through this course, how does the course is designed so that we try to encompass most of the fundamentals and the advanced things in implant dentistry. This 8 courses basically tries to cover the simple to advanced types of implant cases. So the learning outcomes what we have developed in these courses will cover straight to advanced type of implant cases. And just to showcase one of the important thing over here is, this is the first and the only MQA accredited program in the entire Malaysia. This is a very, this is one of the important highlights of this program. The reason is for the Malaysian, the Malaysian qualification agency. It has accredited, which will really help which has really helped us in providing maintaining the quality in in providing the quality of the implant care towards our patient through our students. So that is one of the really key points of this course. So these are around C1 to C8 are the types of are the courses where we will deliver the different types of learning activities. So we start with the first few sessions of fundamentals of implant dentistry, where we try to impart knowledge in relation to the basics, right from your documentation, your photography, videography, what are the importance of, how is the importance of case selection, what is the importance of history taking, what are the different types of implant cases as per the complexity with different classifications. And also we do give hands-on over here on placing different implant systems on the models. And we also do give in this in the first course exposure about on the live patient on how to do the planning in terms of the implant execution. Then we move towards the next course, which is interpersonal communication skills, where the most important is convincing the patient for implant treatment. That is one of the biggest challenge in the general dental practice. So we have specially designed this course where the students have been trained about how to communicate, what exactly are the key points they should, they should communicate with the patient, so that the patient understands the concepts of implant dentistry well, and then they can, give a green signal to go ahead with the delivery of the implant care towards themselves. Moving ahead, once we have trained you in terms of handling the soft skills, we then slowly start expanding the horizon of this implant dentistry course, where we give you exposure on treatment of the implant supported prosthesis for partially edentulous cases. So initially we start with straightforward simple cases where you have good quality bone, you have good soft tissue and hard tissue around the area of edentulous site. And how do you plan? And you start placing implants. You start placing implants by this module, wherein you can do the surgical placements, and also you have been trained to do how to handle the basics of the soft tissue surgeries, right? Different types of incisions, how you manipulate the soft tissue. Yeah, so the basics about soft tissue and hard tissue has been given exposure over here. Also in this course, we also give exposure on handling the certain cases about guided bone regeneration and bone grafting. So in case there are certain cases where it is required, you don't feel it's challenging, you can slowly start even involving yourself in this type of cases. Moving ahead from the partially edentulous, we go towards the completely edentulous. Again, completely edentulous is a totally different proposition from the partial, because the type of case, how do you approach, what is the planning, is really a big area to cover. So we will cover all these things in terms of the completely edentulous, where we will try to cover implant supported over dentures as well as implant supported fixed prosthesis. The reason to cover both of these is because both of them can be the options as per the patient's requirement and as per the indications. And we do also give hands-on on different techniques of face bow, impression techniques for full mouth, yeah, and how do you restore, what are the different types of restorative options for fully edentulous cases. Moving ahead, as we go more towards the advanced type of cases from partial to complete edentulous, we also do need to take care of multidisciplinary care and managing complications. As they say, complication is a part of any implant case, yeah, and it's like a big learning curve. So what exactly is that learning curve? How do you handle the complication? There can be intraoperative complications, there can be postoperative complications. So by the time even you come to your course 5, where you have done few of the implant cases, you might have faced certain challenges where, so we discuss these challenges, how you can prevent them, or how you can counter them in case you encounter during your daily routine practice. So we also do take care that we also teach you about managing implant complications. And the most important is the personal development and the entrepreneurial skills and the professionalism. So here we have specifically designed a special activity on how you can have the scope of developing your entrepreneurial skills, because that is one of the important aspects in any clinical practice. Yeah, and this is an era where these skills do have an importance in terms of expanding your business, expanding your practice. Yeah, so we do have designed this specific module for only just to handle the ethics and the professional aspects. And also, so this C1 to C6, that the first 6 courses are delivered in the first year of the program. And in the second year of the program, we have specifically kept only the entire year to do the cases. Yeah. So in the first year, you will still do your implant cases. It's not that you won't do, you will still start with the straightforward to a bit of advanced cases. And you can do a good number of cases. But also we have given you an extra additional time in case, for you to have that development of the good psychomotor skills before you can say that I am confident enough to independently have a safe and effective implant delivery for my patients. So that's the reason this program is extended from one year to a complete holistic 2 years program, so that by the end of 2 years you are a good finished product in terms of handling the implant case, in totality. Yeah. And to take you through this journey, we have dedicated teaching faculty for the PGDID. We have in-house staff and we also have adjunct staff. In-house staff, we have uh, experienced clinicians, experienced academicians who have had a vast experience in implant dentistry. So we have Prof. To, it was her idea of starting this program. And then we have Prof. Xiao, who is also with us now, and she's also very much helpful in guiding the students towards the clinical cases and also the practical tips. Then we have Dr. Naresh Shetty, who's also the one who is the pioneer in starting this program and who was the initial program director. And Dr. Naresh, if you see, is also one of the examiners for the Royal College. Yeah. So Dr. Naresh has that added advantage to this program, because since he's an examiner to the Royal College, he does offers a lot of help in students who are interested in going ahead and getting the Royal College degree in implant dentistry, diploma in Royal College for implant dentistry. Then I am the current program director. I am a periodontist, and as you know, the perio and implant goes hand in hand. Yeah, because the soft tissue follows the hard tissue, and the soft tissue is one of the important aspects which you really need to respect around the implant, around the dental implants. So I will be handling most of the soft tissue aspect and hard tissue aspects in this course. And also we have the dedicated prosthodontist and oral radiologist. So we have Dr. Rohit. Dr. Rohit has already achieved the diploma in implant dentistry Royal College exam. He's got that degree. Then we have Dr. Rohit Menon, who is a prosthodontist and who has just even completed his master's course in implant dentistry from University of Cambridge. We have Dr. Praveen, who is again an examiner for the Royal College. So we have around 3 examiners. We have Dr. Rohit, we have Dr. Praveen, we have Dr. Naresh, and we have Dr. Prof. To. These are the 3 examiners for the Royal College. So any training in terms of the Royal College exam, they are free to help you, to give you a good exposure in what are the things expected of you to clear the exam. We also have Dr. Shivani, who has recently joined as a prosthodontist in the course. So we have a well-dedicated staff, full-time staff. Other than this, we also have adjunct faculty who are really vast, who have vast of experience in implant dentistry. Like, for example, we have Dr. Elvin Leong, we have Dr. Daylin Leong, we have Dr. Janet. These are the people who are associated with the course for the past 4 years. So these adjunct faculty will also be involved in every course, where they will come to the IMU during the face-to-face week activity, which is the compulsory activity, and they will showcase their cases. They will share their experiences in terms of the implant dentistry. So this will help you basically in understanding how to build up your implant practice by discussing your doubts or your experiences with these stalwarts. Then why to join IMU? Yeah, because IMU is one of the pioneers medical and dental university, and you can see that it has a dedicated oral health center. Yeah, IMU has a dedicated oral health center, and it has a lot of facilities where we have special surgery rooms for the implant dentistry, which are well equipped with well-trained DSAs. We have well-trained DSAs for the oral health care and oral health center, and we also have a dedicated staff at the front desk who will manage all the appointments related to implant dentistry. So we have a dedicated team in the oral health center, which will take care of the clinical aspects of delivering the implant dentistry and the implant care towards our patient. So it's like this. It's like a hassle-free, process. Although it's a bit of, it's like quite a lengthy process, but it's a hassle-free process where it's just about understanding, and the front desk and the DSS will help you to, to have the patient on your chair to treat it well. In terms of the digitalization in implant dentistry, which is one of the most highlights in the last few years, we have the ITI Online Academic Campus. Now, this is one of its kind, facility what we have in IMU, and I think IMU is the only university in Malaysia which has this facility. And what exactly is this ITI Online Academic Campus? This is basically the ITI, which is the International Team of Implantology, is a very renowned private body, and they have a lot of vast resources online. And IMU has had a collaboration with this ITI team, where they have offered us their resources resources at free of cost. So the students who enroll in this program have a free access to all the resources of ITI, like all the webinars, then all the videos, different types of cases. So whenever you have time and you are enrolled as a student for this course, you have the entire 2 years to to run through this entire ITI online academy, imbibe all the knowledge whatever you can, go through and watch the videos, learn different techniques, come and discuss with us or even with the adjunct faculty. So this is like really a boon and a good opportunity to learn from different specialists in the field of implant dentistry through this online academic campus. That's really a great help for even for the faculty to update in terms of their knowledge and their skills. Then we have also collaborated, and we have the digital planner, that is a DTX Studio, which is a software planning for computer guided surgery. As I said, this is an era where most of us want to be very minimally invasive, wants to do a safe and effective implant dentistry practice. And as all of us know that the computer guided surgery is going to be the future for implant dentistry, where a time will come where most of the cases or each of the cases in the clinics will be computer guided to be on the safer side in terms of even the patient morbidity as well as the success. So we do have different softwares available in IMU, and the highlight of this, all of them, is the DTX Studio, where this hands-on will be, you will be trained in terms of how handling this DTX Studio. You can actually place the virtual implant placement on the software, and then you can use the guide what we get out of this planning and use it on your patients. So the effective delivery is done with this DTX Studio. Also, we have dedicated CBCT machines. We have 2 CBCT machines, one from Kevo and one from PlanMeka. This is mandatory for any implant case. Nowadays, CBCT is become how we have the radiograph initially for our endodontics. So same thing, CBCT is important for implant dentistry, where you can actually plan on your own. So again, the knowledge of how to use it, what are the basics of CBCT, all this is being given in the course. And you can use either of these machines, whichever you are comfortable with, and use the software to do the planning in terms of assessing the bone levels. Other than that, we also have the physio dispenser. And this physio dispenser will actually help for your advanced and complex type of cases. Even though the course doesn't cover the complex cases and does cover only the advanced type, you can actually have a feel of how it is being used in terms of certain cases like your ridge expansion or your sinus lifts. Yeah. So you can also observe the functioning of this physio dispenser in this course. And we also have, as I said, digital, from the digital prosthetic point of view, we have the intraoral scanner. This intraoral scanner will, with the aid of the help of the prosthodontist, you can use the scanner in having effective prosthetic delivery. Yeah, effective, efficient, and a fast, speedy prosthetic delivery towards your patients of your implant cases. So this is what exactly we have. We have different types of activities and different modalities and different specialities and different facilities in IMU to be able to achieve the learning outcomes in this course. As they say, assessment drives learning, right? So any course we have, the assessment is one of the important aspects. Although this looks like, oh, a lot of assessments, they are actually not, because they have been spread across 2 years. And the most important is the first one is the portfolio. So whatever cases you do under the PGDID course, that is either in your clinic or maybe in your in IMU, whenever you have time, the portfolio will basically help you to form the entire like a entire information book, where you have done a lot of different types of cases, you have recorded a lot of different types of steps, you do a lot of reflection on your cases. So this is like a learning experience for each one of us. Yeah. And this will help you to be on lesser side of your complications, because the more you reflect on your portfolio, the more you are awareful about your steps in what you're doing. So less will be your complications. Yeah. So you do maintain a portfolio, and as a part of assessment, we do have certain other assessments like the case report, where you submit a case report of treatment planning. Then we have few online exercises like one best answer. This is basically like an MCQ, where you have 4 options, and then you like a quiz where you take up this one best answer and you attempt them so that we get to know at what level you are in terms of understanding the subject. We also have certain theoretical part like the short answer question and the written assignment. This is basically for you to refer to the literature and understand the evidence-based literature and pen down your thoughts, your understanding in these assignments. And also at the end, we have something called as OSCE, that is the Objective Structured Clinical Examination. This will basically help you to understand how exactly what exactly you have understood in the program. So we basically assist you on certain demonstrations what you have given on, say, example, in terms of implant placement, in terms of the soft tissue handling, how do you communicate to the patients. So these are the few assessments what we've included, which will try to, cover all our learning outcomes, what we desire to achieve in this program. So thank you so much for your patient listening. This is what is the course about. And if you have any doubts, you can ask me the questions right now. Yeah. Thank you so much.
Thank you very much, Dr. Ranjit. It's a very comprehensive and enlightening talk with regards to the program, the Postgraduate Diploma in Implant Dentistry at IMU. So if you have any questions, participants for this talk, you can write your questions in the chat box, and we will definitely try our level best to answer your questions. Dr. Ranjit, you have mentioned a few times on the diploma for implant dentistry from the Royal College of Surgeons from Edinburgh, right? We have examiner for the diploma. We have also have faculty who have obtained the diploma from the Royal College of Surgeons from Edinburgh as well. And then in the brochure, right, we have mentioned that our program is benchmarked against the diploma in implant dentistry from the Royal College. Can you please elaborate a little bit more in what sense that we are benchmarking against this diploma from the Royal College?
Yeah, sure. Thank you so much for the question. Regarding the benchmarking with the Royal College, we have tried to set certain international benchmarking standards for the program. The reason is Royal College is one of the prestigious degrees, and we want the students to achieve that. So doing this postgraduate program is one of the key steps in achieving that. How it is? Because the curriculum of the PGDID, is in line or is on designed on the similar lines with that of the Royal College. So the learning objectives what we have developed, they are on the lines of the Royal College. So once the students has graduated from this program, they are well equipped with their knowledge and their skills in attending or in sitting for the Royal College exam. That is the first part. So in terms of the knowledge, in terms of the skills, what the portfolio layout what we have designed again is on the similar lines with that of the Royal College. The reason being, once the portfolio is ready, they have almost, as they say, well begun is half done. So almost once the portfolio is ready, they just need to add in a few cases to this portfolio before they can take up the Royal College exam. So the process what they follow in this 1 year is well within, you can say, in lines of the Royal College. So the same so even the documentation of the patient's consent, the documentation in terms of writing the reflection, documentation in writing all the patient information, all this is on the similar lines of that of the Royal College. So once they graduate, they have almost 70 to 80% record, on with them. So they just add a few cases as per the Royal College specifications, and under the guidance of all our 3 examiners who are willing to help, they can actually appear for the exam.
Okay, that's great. Thank you so much for the elaboration on the benchmarking against the diploma of the implant dentistry from the Royal College. So as you mentioned also, to be eligible to sit for the exam, then the students need to complete 6 cases, right? They need to do treatment plan for 10 cases, and then they need to complete 6 cases as a requirement to sit for the exam. So then how do they get these patients?
Okay, so regarding the patients, we have a flexible option where we have a waiting list for the for the students who come to IMU. Yeah. So the plan is IMU will try to support the students by providing initial first 2 cases. Yeah. So out of the first 6, out of the 6 cases, what they are they have been asked to do till they graduate. The first 2 cases, IMU will try to provide them, and they IMU. So they will actually come to IMU, and they will actually place the implants, do all the steps, do all the processes. Other than these 2 cases, the students are also encouraged to have their own cases from their own practice. So that is one of the key highlights. The reason is, in case if the students feel confident in terms of handling the remaining cases, they have the flexibility of doing the cases in their own clinics.
Okay.
Yeah.
Right.
So we do support them by providing the first 2 cases.
Okay. We also have adjunct staff, the so-called part-time clinical supervisors that can supervise the clinical cases in the students' clinic as well. Yeah.
Yes.
So that is why we say this program is very flexible, in the sense that the students can choose to treat patients in IMU and also in their clinic, and they still can get support in their clinic, because we have specifically appointed a few adjunct staff or so-called part-time clinical supervisors to provide supervision in the students' clinic. Yeah.
Yes. Yes.
So let's say if they bring in their patients, right? Like how much do the patients need to pay? Yeah.
Yeah. So again, to help the students, what we have done is we have tried to collaborate with the industry partners, and the industry partners are really kind on their part. They have tried to help us by providing discounts towards our patients, and that discount we have tried to pass on to our patients by having a subsidized rates for their implant placements and their prosthetics. So it's almost, there's a 50% discount what we have given as per what the IMU charges are. So that 50% discount is given for the first 4 patients, yeah, who is for every student, yeah, who are keen on getting the students, getting the patients to IMU for their clinical practice.
Yeah. Okay. Yeah. So that is like 3,006, right? For those cases.
So it's around 3,600 for from the start to end.
Yeah. So literally it's like maybe only half the price of what they normally would pay for a regular implant in most places, isn't it?
Yeah, absolutely.
So it's actually something of at cost kind of treatment to attract patients to the clinic. Yeah.
Yeah, that is one of the important highlights.
Yeah, you have mentioned that like this course we have designed it as a 2-year course, right?
Yes.
So let's say I'm so busy in the clinic, right? So I may not be able to finish all these cases within the 2 years. So what will happen to me then?
Yeah. So yeah, again, as I said, that again comes in the flexibility. So we have designed the course in such a way that the students have to, that is the minimum period is 2 years, but maximum is 4 years. So 2 plus 2. So in case if you're a student and if you're not able to finish the course in the first 2 years due to whatever reasons, then you have additional 2 years. You have additional 2 years to finish your remaining cases. So the reason to give the additional 2 years, because as you said, most of the practitioners will take some time, to develop their skills. Few of them will require some time, out of their clinical practice. Few of them will say, I want additional time, to do additional cases. So that's the reason we have kept it as minimum 2-year course where the students can graduate in minimum 2 years, but maximum up to 4 years.
Okay, so I actually have quite a long time to finish the course, right? If I'm a student that enroll on this program.
Yeah.
Okay, that's good. So for this program, do we emphasize on one implant system, or how does it work? If a student come on this program, do they only place one system, or will they be able to learn different system and then they decide which one works best in their hand and which one is their preferred choice?
Yeah. So again, to give the student a variety of exposure in handling different components, we have had a collaboration with 3 implant systems. One is Nobel Biocare, one is Astratech, and also Zimmer. Yeah.
Yeah.
So the students can, the students can have a mix of experience in terms of handling different systems. And
Mm-hmm.
after undergoing the training of the hands-on, they can actually try these systems on the patients. So
Okay.
actually they get a hang of, every component, and then they can narrow down to which system they are more comfortable with and carry on with that. So we
Okay,
do have
that's
these
good.
systems.
That's
Yeah.
good. So
Yeah.
there's always a progression regardless which system they use, right?
Absolutely.
Yeah,
Absolutely.
because in a way we have a very good relationship with all the industry partner,
Yeah.
and the system that you mentioned like Novel Biocare, Zimmer, AstraTech, these are all very reputable and well researched implant system. So
Yes.
the students can rest assured that they are giving the best for their patients. Yeah,
Yes.
so for normally for this system, we will teach them from A to Z. So we will also bring in the company to work together with us from placement on the model up to treatment planning, up to placement in the patients. So all these are in progress, right?
Yes.
So
All is in progression. Yeah.
the students can slowly acquire their skills step by step.
Yes,
Yeah.
and also the benefit is that by the time the student graduate, they do have a
Mhm.
good relationship with this industry partners. So
Yeah, that's right.
the benefit is that with any specific webinars or specific conferences of this industry partners, they get these additional benefits of additional discounts or attending a webinar, online webinar at a reduced cost. These are the
Yeah,
small
yeah.
additional benefits also the students can get it.
That's good. That's
Yeah,
thanks for bringing it up.
yeah,
Almost forgot already.
yeah,
Remember last year we had the ITI Strawman conference,
yeah, yeah.
the Southeast Asia Congress
Yes.
in March,
In
right?
March.
Last year. So
The students,
during that time, all our postgraduate students actually get a special conference fee supported by the industry partner to attend this conference.
yeah,
And at this conference, we have really prominent speaker like Dr. Stephen Chan, the
Stephen Chen, yeah,
president of ITI from Australia, to come to
yes,
talk to us. So
yes,
besides learning from the faculty and our adjunct staff, we also encourage our students to attend various conferences and seminars as well to broaden their horizon and
yes,
also their views and knowledge on implant dentistry as well,
yeah.
right?
Even the three masters course, if you remember,
Yeah,
the,
correct,
the
correct.
student, it was quite a comprehensive and a very knowledgeable people
Yes,
were there, knowledgeable doctors were
yes.
there. Yeah, Dr. Iskavan Arban,
Professor Joseph Khan was here.
yeah,
And Stephen Chu was here,
Dr.
and
Arban,
Paulo Cano. Yeah,
yeah.
correct,
So all this
correct.
when they were, yeah. So even we had the privilege to attend their attend this conference of three to four days, and even the
Yes,
students at that time they attended and they really found it quite useful in terms of delivering their understanding and delivering what they have learned from there into their practice. So even the students at that time also got a substantial discount when they were registered as IMU students.
mm. Yeah,
Yeah,
you mentioned at the very beginning of your talk that you are very pleased with our alumni, right? I
yeah,
must say that quite a few of our alumni has gone far in developing their practice in implant dentistry. Would you like
yeah.
to elaborate a few examples that you can share with us how far our alumni has gone so far?
Yeah, so alumni do play a lot of important role. One thing is for us to give us their feedback on how they are doing, and second thing is we also try to involve them as a part of this program. So, for
Mm-hmm.
example, we have the alumni from the first cohort, Dr. Hussein Wakil. Yeah,
Mm-hmm.
he's in fact he's one of the speakers now for one of the industry partners.
No, that's good. Wow.
Yeah, and he's also was one of the speakers at the Implant Dentistry Conference last December,
Mhm.
and
Yeah, correct.
he's also is one of the keynote speakers for the implant software planning. for implant
Yes.
dentistry.
Yes. Wow.
So that is really nice to see that, you know, the people who have passed out from this course are really doing well. And even we have Dr. Ziwei, who just graduated last year. She's
Mm-hmm.
also doing really good in implant practice.
Yeah.
Yeah, so that's really very pleasing to see this, our students doing great job, because implant dentistry is quite a big learning curve, and doing in such a
True.
small time, yeah, it's really nice to see that.
Yeah, because in undergraduate program, implant dentistry only have very small component, because
Absolutely.
it's quite a complex skills and complex knowledge to acquire. So during undergraduate course, they hardly get any opportunity to learn about implant dentistry.
Yeah.
So yeah, you talk about Ziwei. I remember seeing her clinic brochure that
Yes.
she has actually put up a case that she has
Yeah.
treated.
Yeah.
Yeah, yeah, it's really heartwarming to see how far our alumni has gone.
Yeah.
Yeah, that's great. So when will the next intake be?
Yeah. So
Can
now,
you elaborate on the next intake?
yeah. So actually, the intake is normally we planned for every year. For
Mm-hmm.
every year, October is the intake for every batch. But unfortunately, this time due to the COVID-19, we don't want the students, you know, to suffer in terms of uh, you know, we don't want the students to be forbidden from what they should actually get. So the reason is this year we won't be having any intake for the IMU PGDID course, but we have the
Mm-hmm.
next intake in 2021 October.
Yep.
Yeah, and
Mm-hmm.
this 2021 October, we are developing a lot of different ways of uh, adding a lot of new things in the program, developing the curriculum in a innovative way, so that when the students join next year, you know, they kickstart the implant journey in a very positive manner. Yeah,
Mm.
after this pandemic. Yeah, so the
Yeah.
next intake will be 2021 October.
Okay. All right. So 2021. I would also like to share that another good news. We have run this program for 4 cohorts, as you mentioned, right?
Yes.
And recently, we have obtained a 5-year re-accreditation. You know, for
Yes.
MQA, after you run the program for a year, then you obtain full accreditation. So
Yes.
at that time, we get a 3-year full accreditation to run the program. And recently in May, we have also gone through a re-accreditation process, right? So
Yes.
you have successfully led the team and obtained a 5-year re-accreditation. So which
Yes.
is really good. Yeah.
Yeah, it was a good team effort, and what efforts we have really put in for this course, were were noted down by the panel of assessors, and
Mm-hmm.
always they have also given few suggestions, which is always a scope for improvement. But most of
Yes.
most of it is there, is there what we wanted to be delivered, and it was quite well appreciated. And we look forward to incorporate those suggestions and be innovative in our delivery, and we will try to strive hard and maintain the quality of this program. This is one of the important highlights in terms of the quality assurance, because
Yeah.
this is what end of the day we want the graduates who will pass out. We want them to be, motivated towards their incorporating implant dentistry in their general dental practice.
Yes.
Yeah, that is
Yes.
the most important thing. Yeah, I feel. So also, just to go ahead, also I had a few questions and a few inquiries about the program where they have asked about certain more questions. Maybe I can share over here. Yeah. So regarding also in terms of questions, what I received was exactly how do we go about delivering the implant care towards the patient in terms of handling the complications. Yeah, so this was one of the questions what I received from the students who wish to join for this course. As I said, complication is a part of every dental treatment, and we do always encounter these things in implant dentistry also. So complications, we see to it that the students case, if there is any complications, we do try to solve from our side. Yeah, so the students case, if it is in IMU, we will call the patient, we will see what exactly is the cause of the complication, and once the complication is detected, we try to resolve it. Yeah, to the best possible way what we can. The reason is because patient is our first priority. So as I said, since patient is our first priority, we cannot let go the patient, yeah, with complications. So we try to handle the complications in the best possible way, revamp all the complications, and if anything where if the implant has failed or the prosthesis has broken, we do take care with minimal cost to the patients. So the patients, we don't try to don't try to charge towards the patient. We see to it that the patients are not being charged and being given the treatment at the best possible cost to have a good effective function uh, with the oral cavity. This is what is one of the things. The other things, what I received was in case if we don't get cases, then will IMU provide all cases to us? Yeah, IMU will try to provide cases, as I said, as Prof. have asked me. IMU will try to provide cases, but if we have, if since now for this year we have around 8 students, so it's practically not possible to provide all the 6 cases to each and every student. But IMU will make an effort to what best possible cases we have, we'll try to provide them, and see to it that the students complete all the 6 cases of different case mix. It's not only one type of cases the students are doing. Yeah, they do have a different types of case mix where they come and then they discuss with us, they do the implant planning, they place the implant, they do different types of prosthesis, so that the students will get a good exposure when they graduate. So we will try to support, but it is also encouraged that in the students can get their own patient from their practice, so that they finish the cases and get early exposure. Yeah, so that the waiting period is not that great. That is one thing. Yeah. Then one of the question was that yeah,
and also Dr. Ranjit, I would also like to add on that we also have set up an implant screening clinic, right?
yes,
To help to the students to get patients. So if undergraduate students, if they have patients that would like to have implants, then they will refer for the implant clinic for screening, and then we will refer accordingly for our postgraduate students as well. So
yeah,
that is another avenue that we are helping the students to get patients as well. Yeah.
yes. So we have a dedicated implant clinic what we have set up in IMU, and which is like, you know, like one point of contact, and from there it's been channelized towards different students as per their skill levels. So the students will get out of those waiting list different types of cases for their implant dentistry practice in IMU.
Good. Yeah. So we are trying our level best, definitely, to help students to get patients. So far, patient flow has been good, and students have been able to complete their cases. Yeah.
Yes.
Yeah. So, and let's say Dr. Ranjit, we have students actually, especially for this particular batch, that come from various states in Malaysia, right?
Yes.
We have students that come from USM, we have students that come from Ipoh, we have students also come from JB as well, right?
Yes.
So would you foresee any issue with these students coming from various states in Malaysia?
So the reason is we did foresee these things where the students who are coming out of Kuala Lumpur, what we have done is it may not be possible for them to visit IMU frequently, yeah, for their clinical cases. So how we have seen to it that we have appointed specific clinical supervisors in those different areas, dedicated areas, yeah, where we feel the
Yes.
students, yeah, we can get potential students. So the benefit of this is that the students can coordinate with these clinical supervisors appointed by IMGO, yeah, and
Yes.
yeah, and they can actually coordinate, and then they can also discuss with the supervisors from IMGO about the treatment plan. And once both the supervisors agree, the student can the supervisor will visit the student's clinic, and the
Yes,
student will
that's right.
complete the clinic case, the implant case in their own
Yes.
clinics under the guidelines as a from the supervisor. So
Correct.
the benefit is that the students can get a good experience of practicing implant dentistry in their own clinic with a different eye from the clinical supervisor's experience. So these are the additional benefits what we have tried to incorporate for the off-site clinical practice.
Correct, correct. Like I said earlier, we have appointed part-time clinical supervisors from either the university or from the private practice who are very experienced in implant dentistry to
Yes.
act as our part-time clinical supervisors, right?
Yeah.
You know, almost every cohort, we have students that come from various states.
Yes.
This the 2019 we have people come from Ipoh, JB. I remember the 2018 batch. We have candidates who come from East Malaysia also. Yeah, you remember we have
Yes.
a student from state of Sarawak.
Sarawak, yeah.
Yeah, correct. And then previous batches also we have students who come from Kuantan and
Terengganu,
Terengganu.
yes.
Yeah, that's right. So we always every batch we have students that come from various states, and we are able to appoint supervisors that are nearby to them to assist them in their clinical practice. Yeah.
Yes. Yes.
What some of the students also may do is after the face-to-face 1 week, then they have they stay back for a little while. You know, they stay back for a little while to treat some patients before they go back to their hometown. Yeah.
Yes.
So all this can be worked out in that sense.
Yeah. So that all these things we do try to support the student in the best possible way what we can. To see that they achieve all the learning outcomes and they become good good implantologists at the end of the course.
Correct. So that is the ultimate aim for this course. Yeah. So moving on, so you have elaborate on CBCT and you have elaborate on intraoral scanner as well. So I would also like to add on, we actually can have a full digital workflow support for our students in a sense that we also have a CAD/CAM machines in our lab as well. So once they take the digital impression, they can send it to our lab. Our lab can design the surgical spline, or they can design the prosthesis using our CAD/CAM machine too. Yeah.
So that is the next step what we are planning. When, as I said, we will be coming up with the innovative things, because even though this is a diploma course, we want the students to have the maximum exposure in terms of the digital implant dentistry.
Correct.
So having this in-house facilities is the next step, and by next year we will be definitely having this with in our armamentarium of delivering to the students as well as the patients.
Yes. We have to catch on with the technology.
Yeah, it's very important. Yeah.
Okay. Any more questions from the audience? Please feel free to write it in the chat box. we will try our level best to answer your question. I think we have managed to answer most of the question, or if not all of the questions that has been posted to us. So again, I would like to take this opportunity to thank everyone to come on to our live talk to listen to Dr. Ranjeet Bapat for our postgraduate diploma program in implant dentistry. Take care, everyone. Keep well and have a great weekend. Thank you very much, everyone.
Thank you so much. Thank you so much.
Thank
Take
you,
care.
Dr. Ranjit.
Thank you. Take care.
Take care.